السلام عليكم ورحمة الله وبركاته. استكمالا للمحاضرة الخامسة بالtrace element. Today we will talk about the non-essential trace element. The ions discussed in this lecture are currently considered as non-essential, even though some of them have a beneficial pharmacological action in appropriate dosage. Today we'll start with fluoride. Fluoride are widely used today for their anti-carcinogenic action, inhibition of dental caries development. It's work by increasing the tooth resistance to acid, promoting remineralization, and inhibiting the process by which bacteria promote cavities. The second use of fluoride is required for bones. At about 95% of orally taken fluoride is absorbed, and 50% of ingested fluoride is secreted in urine. Some fluoride is excreted in the perspiration. There seems to be an excellent margin of safety between the effective dose of 2.2 mg of sodium fluoride per day for prevention of caries and the acute lethal dose of 4 gram. The sources of fluoride is seawater, groundwater, fish, and tea. The other significant sources of ingested fluoride are toothpaste in very young children who tend to swallow most of their toothpaste. The case of water fluoridation is controlled addition of fluoride to a public water supply to reduce tooth decay. The fluoride concentration is kept at a safe level between 0.7 to 1.2 milligram per liter. The danger of fluoridation. Some of opinion of water fluoridation have made claim that optimally fluoridated water can cause an array of health problems such as the dental fluorosis, increased bone fractures, lower intelligence quotation in children, and increased lead uptake, allergies, Alzheimer's disease, effect on renal, gastrointestinal, and immune system. The short review about the dental fluorosis or mottled enamel. Hypomineralization of tooth enamel caused by ingestion of excessive fluoride during the enamel formation, and it appears as a range of visual changes in enamels causing a degree of intrinsic tooth discoloration. The severity of this condition is dependent on the several factors including dose, duration, and age of individual during the exposure. The mildest form, the most common case, is characterized by faint white line of speak. The second case as moderate appears as a white mottled patches, and the final one, the severe fluorosis, as brown discoloration, brittle and rough enamel. For the prevention of this case, first by limiting the ingestion of topical fluoride products such as the toothpaste, of course, and the second one, appropriate use of dietary fluoride supplements. Here are some pictures to differentiate between the normal, mild, and moderate and severe dental fluorosis. The second non-essential element, bromide, were introduced in medicine since 1857 for their anti-epileptic, anticonvulsant effect as a potassium bromide by Sir Charles, and can be regarded as the first effective medication for epilepsy until the 1912 when phenobarbital was discovered. Sodium bromide remain in the over-the-counter as a sedative and headache remedies in U.S. until the 1975, when bromide were allowed OTC medicine due to the chronic toxicity as the bromisms mean bromide poisoning. The therapeutic index of bromide is small. Sometimes even therapeutic dose may give rise to intoxication, often indistinguishable from the side effect, and this includes the lethargy, loss of appetite, nausea, and emesis. Bromide is rapidly absorbed and are excreted mainly in urine, and repeated doses tend to cause accumulation with a consequent replacement of a chloride ion. The treatment of this case of intoxication by administration of sodium chloride, 60 grams daily in individual doses, or ammonium chloride used. The third non-essential element in our lecture today, we will talk about the gold, and it is used in the rheumatoid arthritis and called compound regarded as the oldest disease-modifying anti-rheumatoid drugs. The therapeutic gold compound are administered generally intramuscular. Oral products are poorly absorbed and irritant. The gold is rapidly enter the plasma where it remains bound to albumin for several days, so it is usually administered weekly. Two gold preparations are available in pharmacies administered via intramuscular injection, which is the gold sodium thiomalate and oral thioglucose, gold sodium thioglucose. The oral preparation is ranolfene produce lower steady state blood gold concentration than the dose treatment with a parenteral gold compound, but it also produce a lower incidence of adverse effect. The case of gold toxicity involves the dermatitis and pruritus, stomatitis preceding by metallic test. Also involve the joint, blood, kidney, liver, and nervous system. Blue or gray skin discoloration can arise from gold deposition in the tissue, and the photosensitivity may also occur. For treatment of the gold toxicity involves the station of administration and supportive treatment and hasten the elimination of gold from the body by penicillamine. The gold is contraindicated in the following cases, including the systemic lupus erythematosus, skin disease, uncontrolled congestive heart failure, hypertension, hepatic and renal disease, and inflammatory bowel disease. The fourth non-essential element is lithium. The first use of lithium in mid of 19th century to treat gout. 1940s substitute for NaCl in hypertensive patient, but it proved too toxic when available without monitoring and was stopped. It's a depressant to the CNS, and the circulation also has a diuretic action. Its toxic effect is aggravated by a reduction in sodium intake, that's a very important point, and lithium is closely related to sodium and its properties. It's already absorbed from the intestine and accumulate in the body. The extent of the lithium accumulation is dependent upon sodium intake, as we said before. Decreased sodium intake accelerate lithium accumulation and potentiate or accelerate the toxicity. Lithium intoxication is treated by the withholding the lithium salts and provide an adequate sodium intake. The first compound is the lithium carbonate, and is administered or taken orally in manic depressive disorder, bipolar disorder, and it is effective treatment in 75% of episodes of acute mania, and its usually its therapeutic action takes 2 to 3 weeks to develop, and usually used in combination with the lorazepam and diazepam. Lithium carbonate can affect the thyroid function, causing myxedema, which means decrease the thyroid function. And lithium can cause diabetes insipidus, which means increase in urination without glucosuria by interfering with the action of the vasopressin. Since lithium toxicity increases with a decrease in sodium intake, patients on salt restricted diet or those who are receiving diuretics should be monitored carefully. Now we will start with the part 2 of our lecture today, talking about the dental products. A number of inorganic compounds are used in maintaining the oral and dental hygiene. Most of these products are over the counter, which include the anti-caries agent, polishing agent, desensitizing agents. We will talk for each agent separately, and it was starting with the anti-caries agent. The dental caries or both tooth decay involves in a gradual demineralization, softening of the enamel and dentin. If it is not treated, then the microorganism may invade a bulb, causing inflammation and infection. With subsequent death of the bulb and abscess of the alveolar bone surrounding the root's apex and requiring root canal therapy. The tender caries, that is to say, the cavities are formed by the growth and inflammation of the carcinogenic microorganism. Diet is another factor in the development of the dental caries. The type of diet with a high concentration of the fermentable carbohydrate increases the risk of these cases of the dental caries. Starting with the fluoride is anti-carcinogenic and its form fluorapatite in the outer surface of the enamel, and the fluorapatite hardens the enamel and makes it more acid resistant. Fluorapatite has shown the antibacterial activity. Also, the fluoride is not beneficial at an age of 12 or 13 because unerupted permanent teeth are mineralized during that time. The fluoride can be administered by two routes, orally and topically. As we said before, the fluoridation of the public water supply is the most convenient, effective way of the oral administration. The fluoride can also be administered orally as a sodium fluoride, tablets or drops added in water or fruit juice. A 2% aqueous solution of the sodium fluoride is widely used topically, and a freshly prepared 8% solution of the stannous fluoride is also extensively used for typical application fluoride. Inorganic phosphate salt can also be useful in the prevention of the dental caries, as has been shown that soluble salt of the phosphate can cause caries reduction in the mean. The second polishing agent is the dentifrice contain agent for cleaning tooth surfaces and providing polishing effect on the clean teeth. These agents are abrasive in nature and they are responsible for physically removing plaque and debris. The final agent is the desensitizing agent. Reduce the pain in sensitive teeth caused by the cold, heat, or touch. These products should be non-abrasive and should not be used on a regular basis unless directed by the dentist, such as the zinc chloride and cystidine and other products.